Hi, I'm Dr. Mark King from Mount Lookout Chiropractic and Sports Injury Center. We're going to talk a little bit about disc injuries, disc issues. A lot of you have had the experience of bending forward, maybe to pick something up, and what the layperson says is their back goes out. And often that leads to a disc injury that often leads to pain down the leg. Kind of the classic things people will say is, I bent over to pick something up off the floor and that got me in trouble. It could be something heavy or not heavy. Worse in the morning, first thing in the morning is where it happens more than any other time. We'll talk about three things with regard to disc. One is a herniated nucleus pulposus, which the layperson says is a slip disc, bulging disc, that kind of thing. That tends to happen more in the young population. Degenerative disc disease, which is specifically about the degeneration of the disc. And then the term degenerative joint disease is a more general term for any joint. Though the degenerative disc disease is more for the older crowd. So herniated disc is a little bit more likely to be younger. Degenerated is a little bit likely to be an older crowd. So again, those terms you often hear as a slip disc or a degenerated disc. And people often say with the degenerated that they have bone on bone. And it doesn't, typically if it gets anywhere near that point, people are going to have too much pain to just ignore that. So they're going to be doing something about that. I wanted to show in this model here quickly though, to give you an idea. This is normal. This is looking at you from the front and the low back. And it has a nice healthy disc, and there's a vertebrae disc, and it's nice and healthy and thick. So then this degenerated disc, you can see, again, looking at the front, you can see the spurring, you can see the disc space is smaller, and so they're just less padded. So it's easier to get aggravated there. That's like having older tires. Now this is the herniated disc. It shows a little degeneration in the front. I'm going to turn it around looking at it from the back and the side, which is the typical pattern. You can see the bulge there on that herniated disc, that bulging disc. And there's different categories of herniated disc, but the general term is herniated disc. And that's where it eventually inflames that nerve root and causes pain. So what causes this? Well, actually the disc is stronger than the bone. The bone there on that is called the end plate. And the disc is actually literally stronger than that and will crack through the end plate. And then that starts this inflammatory reaction. And then the nucleus, the centerpiece, starts to essentially leak out, if you will. And eventually it irritates the nerve root. Once that's inflamed, that's when the problems really start as far as from pain. So you have an area that's fixated, meaning it doesn't move enough. The disc has to do more. It either can herniate or it can wear out. Or you can have what we call functional instability, which means weakness in an area that doesn't support that disc enough. So what happens then? Then the disc is doing more work, more load, it can herniate again, or it can degenerate again. So either of those problems lead to the common disc problem of either a herniation or degeneration. The common thread through this is sitting. Prolonged sitting makes you more vulnerable to this. And then repetitive flexion with rotation, bending over to pick things up with poor form, and bending, lifting, rotating, that's setting yourself up for trouble. It's important to get these things under control. There's a study, an old study really, that if you're off work for 6 months, there's only a 50-50 chance that you're ever going back to work if you're off work due to this disc herniation problem. If you're off for a year, only a quarter of those people, 25% of those people are ever going back to work. There was a 2012 study in the journal Spine where they compared people that had a back injury. Did they go to a chiropractor or did they go to a spine surgeon? Now, sometimes you have to go to one or the other, but these people were put in, could see either one. And this was a Washington State workers' comp study. If they went to the chiropractor first, 1.5% of them had a back surgery. If they went to the spine surgeon, over 42% of them had a back surgery. So start with conservative care first. We know that people need NSAIDs, non-steroidal anti-inflammatory drugs sometimes to help with pain. We know people need epidurals to help control the pain. We send people for those. Medrol dose pack like a prednisone, we know people need that sometimes to get the pain under control. We're well aware of that and we refer people out for that, but we want to start with conservative care first. So talk to your doctor about getting more information on what you can do, whether you need chiropractic adjustments, whether you need rehab, a combination, or just what. But we're here to help, and let us know how we can do just that. Thank you.